Do you frequently feel like your heart is racing even when you're just sitting? Or maybe you get tired so easily while walking or climbing stairs. These might not just be from stress or poor fitness. For some people, these signs can be clues to a blood condition called alpha thalassemia. Imagine your red blood cells as tiny delivery trucks carrying oxygen to every part of your body. In alpha thalassemia, these trucks are weak or too few, so oxygen doesn't reach where it's needed. That's why people often feel weak, pale, or breathless. It's like trying to run a marathon with half the fuel you need. So what causes this problem? Let's think of your body like a factory, and your genes are the instruction manuals. For healthy red blood cells, your body needs a protein called alpha-globin. This is made using instructions from 4 genes too, from each parent. In alpha thalassemia, one or more of these genes are damaged or missing. It's like losing pages from the manual your factory body can't build the full protein. If one gene is faulty, you might not even notice. But if 2 or more are affected, the factory starts making defective trucks, red blood cells. The more missing genes, the worse the symptoms. It's not caused by bad food germs or stress, it's something you inherit, like eye color. Have you ever felt unusually pale, even when you're not sick? Or does your child seem tired all the time, even after sleeping well? People with alpha thalassemia might also have yellow eyes, jaundice, a swollen belly from a large spleen, or slow growth in children. Some carry mild forms and live normally, but others, especially babies with the most severe form, can face serious problems before or right after birth. One mom said her baby was always sleepy and not gaining weight. It turned out the baby couldn't make any alpha-globin at all. That's rare but life-threatening. So, if your body is always saying "I'm tired," it's okay to ask why. How do doctors find it? Let's pretend you went to the clinic because you're always worn out. The doctor might do a simple blood test. It checks the size and shape of your red blood cells. In alpha thalassemia, they're smaller and paler than normal. These tests can't always tell it apart from iron deficiency, so doctors sometimes add another test, checking your iron levels. If iron is fine, they might look at your genes. A genetic test is like reading the full instruction manual to see which pages are missing. Treatment depends on how bad it is. Mild cases, no treatment needed, just regular checkups. Severe cases, blood transfusions help, like refilling the fuel tanks regularly. Some patients need a spleen removed or even a stem cell transplant, which is like giving the body a new factory to build better blood cells. Can we stop it before it starts? Yes, but not by eating better or exercising. Since it's passed in families, prevention focuses on knowing your risk. Think of it like checking the weather before a trip. If you and your partner both carry faulty genes, your child could inherit the condition. A simple blood test before having kids can show if you're a carrier. Genetic counseling helps you understand the odds. In some countries, couples are tested before marriage. One couple found out both were carriers. They chose IVF with genetic testing to have a healthy baby. While we can't change genes yet, we can make informed choices to protect future children. What's new in science? Scientists are now working on fixing the broken instruction manual itself. It's like editing a typo in a recipe so the cake turns out right. Gene therapy is a big breakthrough. Doctors take a patient's blood stem cells, fix the faulty gene in the lab, and put the cells back. Early trials show some patients no longer need blood transfusions. Another study uses drugs to boost another type of globin, gamma globin, to compensate. It's like teaching an old machine a new trick to do the job. These advances aren't available everywhere yet, but they bring real hope. One teen in a trial said, "For the first time, I feel like a normal student." Science is moving fast, and patients are at the heart of it.